5 USMLE-style questions focused on trinucleotide repeat expansion diseases, incorporating the mnemonic. Question 1. A 35-year-old male presents with progressive motor dysfunction, including chorea, psychiatric disturbances, and cognitive decline. His family history is significant for early-onset neurodegenerative diseases in several generations. Genetic testing reveals CAG trinucleotide repeat expansion in the Huntington gene. Which of the following is the most likely mode of inheritance for this disease? A. Autosomal dominant, B. Autosomal recessive, C. X-linked dominant, D. X-linked recessive, E. Mitochondrial inheritance. Answer: autosomal dominant. Explanation: Huntington disease is caused by CAG trinucleotide repeat expansion in the HTT gene. It follows autosomal dominant inheritance and presents with motor dysfunction, chorea, cognitive decline, and psychiatric symptoms. The mnemonic, caudate has as ACH and GABA, helps to remember that Huntington disease involves degeneration of the caudate nucleus, which affects the production of acetylcholine, AH, and gamma-aminobutyric acid, GABA. Question 2. A 50-year-old male with a family history of early-onset dementia presents with difficulty walking, loss of coordination, and muscle weakness. He has a protruding chin and enlarged testes. Genetic testing reveals CTG trinucleotide repeat expansion in the DMPK gene. What is the most likely diagnosis? A. Huntington disease, B. Myotonic dystrophy, C. Fragile X syndrome, D. Friedreich ataxia, E. Spinocerebellar ataxia. Answer B. Myotonic dystrophy. Explanation: myotonic dystrophy is caused by CTG trinucleotide repeat expansion in the DMPK gene. It follows autosomal dominant inheritance and is characterized by muscle weakness, myotonia, difficulty relaxing the muscles after contraction, protruding chin, enlarged testes, and frontal balding. The mnemonic, cataracts, 2P, early balding in males, gonadal atrophy in males, reduced fertility in females, helps to remember the key features of myotonic dystrophy. Question 3. A 22-year-old male presents with ataxia, dysarthria, and loss of coordination. Genetic testing reveals GAA trinucleotide repeat expansion in the FXN gene. What is the most likely diagnosis? A. Friedreich ataxia, B. Huntington disease, C. Fragile X syndrome, D. Myotonic dystrophy, E. Ataxia telangiectasia. Answer A. Friedreich ataxia. Explanation: Friedreich ataxia is caused by GAA trinucleotide repeat expansion in the FXN gene. It follows autosomal recessive inheritance and typically presents with ataxia, dysarthria, and muscle weakness. The mnemonic ataxic can help remember Friedreich ataxia, as it involves ataxia and GA repeats. Question 4. A 40-year-old male with a family history of early-onset neurodegenerative diseases presents with chorea, dysphagia, and impaired cognition. Genetic testing reveals CAG trinucleotide repeat expansion in the HTT gene. What is the most likely mode of inheritance for this condition? A. Autosomal recessive, B. Autosomal dominant, C. X-linked dominant, D. Mitochondrial inheritance, E. X-linked recessive. Answer B. Autosomal dominant. Explanation: Huntington disease is inherited in an autosomal dominant manner, with CAG trinucleotide repeat expansion in the HTT gene. This leads to neurodegeneration, and the mnemonic that has ACH and GABA helps remember the neurotransmitter involvement in the disease process. Question 5. A 30-year-old male presents with progressive loss of coordination, muscle weakness, and nystagmus. Genetic testing reveals CTG trinucleotide repeat expansion in the DMPK gene. What other feature would most likely be seen in this patient? A. Cataracts, B. Autosomal recessive inheritance, C. Hearing loss, D. Enlarged heart, E. Frontal baldness. Answer: cataracts. Explanation: in myotonic dystrophy, CTG trinucleotide repeat expansion in the DMPK gene leads to muscle weakness and myotonia. Patients often develop cataracts, which is one of the classic features. The mnemonic, cataracts, 2P, early balding in males, gonadal atrophy in males, reduced fertility in females, helps to remember the clinical features of myotonic dystrophy. These questions focus